Welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, and we're here today with Julie Lenyk, a counselor here at Meridian, to talk about an uncomfortable subject and something that has been brought to light because of the tragedy in Newtown, Connecticut recently, is that when these types of incidences happen, what advice can we give to parents about what do we say to our kids who are seeing this, who know what happened? What can we tell them to do?
It's important for the parents to, first of all, consider the different age range of their children. Obviously, younger children who are toddlers, don't necessarily understand what is going on, but they can see a reaction that's occurring with their caregivers. Middle-aged children typically have more of an understanding of what's going on and may have still some difficulty expressing their concerns. And adolescent children typically, obviously they are aware of what's going on, but might not want to communicate as much as maybe younger age children. So it's important for the parents to kind of gauge that first and get an understanding of, what age they are and what they're, how they're willing to communicate. But overall, it's really important that parents and caregivers have open conversations with their children and allow them to talk about the things that they need to talk about.
And usually as parents, if we're good listeners, the child will usually set the direction for the conversation, I'm sure.
Right.
What about, are there indicators that we can look for in our children to see, how much they are affected by these types of incidences?
Yes, a lot of times younger children will kind of model the behavior that they're seeing in the parents or caregivers. So if they are acting upset, it's typically because they're seeing their caregivers act upset. School-age children, typically because they spend so much time in school, they'll have more difficulties in school. And that's where you'll see a lot of the behavioral issues and just different ways of acting out. And a lot of times adolescents tend to kind of close up and not want to talk about things, or they may also act up in school or at home.
And I'm sure that schools all around the country are talking about what they can do, not necessarily from a security standpoint, but strictly from how are we going to help our children continue to feel safe coming to school, and how are we going to continue to help parents feel that they're sending their child to a safe place every day. So I'm sure the schools are going to be very active right now, and I think as an organization we want to be available to the school systems that we can lend any advice that we can. But I guess the other question I would want to know is, my children were small after 9/11, and the question that we always had was, how much television do we let them watch? And I think that is an interesting point here too, with all the media attention that this event is getting.
Right, because they're going to be aware of what's going on, and they're going to see things that are going on, on the television and the media. So it's important that you limit how much time they spend watching anything on the TV, and it's also important that you take the time to be there with them and be present when they're seeing the media and the different coverage.
Well, this is a really important topic, and it's sad that we have to have this conversation, especially during the holiday season. But we want to make sure that the parents that are out there know that there is a place at Meridian that you could always call for consultations and to get any advice that you want on this topic or any other topics around behavioral health. And with that, I just want to thank you, Julie. I think it's been very informational.
Thank you.